Hi, everybody. Welcome back to the Pelvis Party. My name is Becky Monpetit. I am the owner of Rochester Local. And as always, I'm joined by two wonderful guests on the Pelvis Party today. First up is Dr. Melissa Richards. She is the Division Chair of Hospital and Surgical Services at Olmsted Medical Center. And Britt Marshall with Marketing and Communications at Olmsted Medical Center. Welcome. Welcome back.
Thank you.
I love our Pelvis Party morning.
Good.
Right?
It's so good. We're getting these awesome guests now.
I know. We've had such
good.
wonderful guests on the Pelvis Party, but I love when we are able to come back together too. And today we're talking about something that I've never really heard about until very, very recently, and most likely because I have conversations with you. Yeah. We're talking about colposcopies.
Colposcopies.
All right. Colposcopies. Lots to dig into here. Maybe literally. I don't know. Oh, bad joke. Okay. So we're talking about colposcopies. Let's just dive right in. What is a colposcopy?
Good question. What if I said it was a bad question?
I mean, you could.
Next question, please.
Wrong. Moving on.
Saucy. Okay. So we're going to take one step back. Colposcopies is our way of diagnosing precancerous or cancerous cells of the cervix. Okay. So that one step back, my one step back is your pap smear and your HPV testing. So cervical cancer screening. So after age 21, no matter what your, when you started having sex or having pelvic infections or whatever, it's age 21. The recommendations are to have some type of cervical cancer screening. We at Olmsted Medical Center follow the ASCCP guidelines. So women in their 20s, we do a pap smear. And what a pap smear is, I should have brought props.
Next time. Can't wait to get into this.
I know,
though.
I drew some pictures.
Yeah.
A pap smear is where I take, actually we can get right in it. So anatomy. This is the vagina. This is the uterus. Here are some fallopian tubes, and these are ovaries. When I do a pelvic exam, when I put the speculum in the vagina, I see the opening of the uterus, which is the cervix. Fun fact, your cervix is just the lower portion of your uterus. Like your cervix is part of your uterus. So people are like, hey, when it's the one piece, right? Okay. So when we do the pap smear, I'm taking a brush and I'm taking the brush and kind of swiping it over the cervix right here. So I'll take actually that brush and show patients who haven't had, it doesn't hurt when we do the pap, like the actual brush. Sometimes it's sensitive to have something touching your cervix, but nothing invasive or sharp with that brush. So do that, send it off to pathology. Our pathologists or cytotechs are awesome. And what they'll do is, depending on your age, they'll either just look at the cells, and when they look at the cells, they'll say, these look normal, that's awesome. And then after age 30, we're also testing for HPV, the human papilloma virus. We know women with cervical cancer will test positive for HPV, the human papilloma virus, certain strains. So the neat thing is we used to do pap smears every year. And now, if you're considered very low risk, meaning your cells look normal, you test negative for HPV, we're not worried about you.
Okay.
Come back in 5 years for your cervical cancer screen. Come back next year for your well exam.
And maybe, as we talked about before, pelvic exam and pap smears are separate. Right.
Exactly. But for some women, when we get our pap smear results or the HPV results, we need more information before we feel fine just waiting another year or 3 years or 5 years. Okay?
And do you have indicators that tell you that?
Yeah. So looking at the cells themselves, they'll either, I like to, this is normal, this is cancer on the other side of the room. So when we do a pap smear, typically it'll come back normal. It might come back with something called LSIL. I'm not going to spell out what that means. Okay. But those are precancerous cells. Those have the potential to be precancerous cells. Sometimes we have you come in for a colposcopy. Sometimes we don't, depending on HPV status. And then, by the way, this is a 45-minute talk that we're going to do in 5 minutes.
We're just going to shove it all in. Yeah, absolutely.
Not to scare anybody. I'd be going, woo, woo, woo.
Exactly, right? Yeah. Exactly. So it's really important to tell people that what pap smears are screening tests. So they're screening before we would do a diagnostic test. So we don't typically diagnose cervical cancer based off of a pap smear. LSIL, looks like precancerous cells, can't say for sure. Let's see what our HPV status is. If HPV is negative, we'll say, you can't wait 5 years, but we'll see you next year. We can have something called HSIL. HSIL, we want more information. So HSIL, we're going to do a colposcopy. There are some goofy ones out there. ASCUS, get this, atypical squamous cells of unknown significance. Atypical squamous cells of unknown significance. So when they looked at the pathologist, the tech looked at they literally said,
ASCUS?
They literally said, I don't know. So then the HPV status really matters. So if you're HPV negative, other things can cause an ASCUS pap, maybe some inflammation, infection.
Sure.
So if they're HPV negative, ASCUS HPV negative, see you in 3 years. If you're HPV positive, we're going to do a colposcopy.
Okay. So that was a lot of really good background information.
So much. And, there are a couple of other diagnoses out there, but we're not going to go in.
Okay.
That you can get off of a pap smear. Okay. So now we've decided we need to do a colposcopy because we need more information.
Sure.
Do you remember doing the glucose test when you were pregnant?
Totally.
All right. So the glucose test is a great example of when you take and drink this sugary drink and then an hour later check your sugar level. If you pass the test, awesome. If you don't pass the test, right? It doesn't mean you have diabetes though, right?
Right. You just have to take
it means you have to do the 3-hour test.
Yes.
The colposcopy is the 3-hour test.
Gotcha.
Okay? That's how we diagnose. Okay.
It's a really good way to explain it. Yep.
I just started doing that like a week ago with a patient, and they loved it too.
Yeah.
I would have just incorporate
Keep it.
that. Yes.
Tuck it into your little toolkit. Yep. Perfect.
I don't know where my toolkit is. Maybe like right there. Okay. So now we're in for the colposcopy, and if I have the opportunity, I definitely try to prep a patient for that.
Yep.
Because when oftentimes I walk into that room for the colposcopy, 2 things are happening. They're scared about the pain.
Yes.
Or they're scared they have cancer. They're pretty confident they have cancer, that they have cervical cancer. I draw my picture here, and I kind of explain, okay, what are we doing? I go through the pap smear based on the results, like why they're sitting here today, all that fun stuff I just talked about. Said, okay, what we're going to do is I'm going to put the speculum in, just like when you had your pap smear. And then what I'm going to do is I'm going to put some acetic acid, which sounds really scary.
Yep.
It's vinegar. So I'm going to put some vinegar solution on your cervix. And what I'm going to do, look at this, magnifying.
Wow. Okay,
cool?
Perfect. Yes, you did a great job.
Thank you.
Yep.
So this is the cervix. What I'm going to do is I'm going to look very closely after I put the vinegar solution on. I'm going to look in this area. Okay, this is what we call the squamocolumnar junction.
Oh.
Okay, all right. This is where the cells inside the uterus, glandular cells or columnar cells, like the cells when we get our period, meet. So those look like that. I don't know if you can see that. Meet the cells inside the vagina. So it's a place where cells meet.
Okay.
Okay?
Okay.
Naughty things like precancerous or cancerous cells love chaos. And so what we want to do is we want to see where those columnar cells meet the squamous cells to see if there are any precancerous or cancerous cells. And typically these cells will turn like a bright white. So that's what I'm looking for. I'm looking for bright white.
Okay.
So if I see bright white, what I'm going to do is I'm going to take a little biopsy, and the biopsy literally is typically like that big. So it's really super tiny.
Okay.
Yes. Yeah, it's super tiny because your cervix isn't this big. It's like, it's not that big.
But that doesn't hurt when you take that little.
Well, so there are some tricks to trying to reduce discomfort or pain because there's also like that anticipatory feeling. So typically what I'll have my patients do is I'll say, okay, give me a cough, and right as they cough, I'll do the biopsy. And that seems to help a little bit. Some people they're like, oh, I felt nothing. And some people are really sensitive. Their cervix is really sensitive. And I think just prepping yourself and knowing that some people are more sensitive is very important. I have had patients where I've actually numbed the cervix. There's a benefit to that because you've now numbed the cervix for those biopsies. At the same time, in order to numb, I have to poke your cervix. So that can be uncomfortable.
My trick is always wiggling my toes.
Wiggling your toes. I love the wiggling your toes trick. Just kind of helps kind of take your mind off.
Loosen your muscles. Take your mind off something else. Exactly.
Totally. Yeah. Absolutely. And typically, when we do these little biopsies, it might be 1, it might be up to 4 or more.
Yep.
And then I joke because I try to, create a rapport with my patients. There's one more thing that I typically need to do, and I do need to take a little bit of a biopsy inside the cervix, and that's crampy. That's like period cramps.
Yeah.
That's gross. And so you've really fallen in love with Dr. Richards. She's the best doctor ever. But this is when we become not as great friends, when I do this little biopsy inside the cervix. And then
temporary.
It's temporary. Then afterwards, counsel patients. You're going to have some funky discharge afterwards. Bleeding like a period is not normal, but you'll probably bleed for a couple days.
Yeah.
That vinegar solution. Sometimes we have another solution called Lugol's that makes your discharge a little brown.
Okay.
So expect funky discharge for a couple days.
Okay.
We also encourage no sexy time, nothing in the vagina for about 40 hours before a colposcopy.
Okay.
Please don't, if you're going to have a colposcopy, don't put anything in the vagina for 2 days. Please, please, please. Sometimes we have to reschedule you.
Oh, no.
I know. And these colposcopies are just so important that we want to make sure that you do them.
Yep.
So I do my little biopsies. I do my little biopsy inside the cervix. And then I'm like, great. Usually the results take about 7 to 10 days.
Yeah.
Sometimes there are special stains that our pathologists do, very fancy CSI type things to really make sure that they know what is going on.
Yep.
And then we'll get the results. Okay, so now I have the results. And the results come back normal, totally normal cells.
Yeah.
Woo!
Yes.
Great. Awesome. So in that case, we will tell you, like, see you in a year. Please come back, get your pap smear, get your HPV testing done. You can do it. Go ahead.
And are you calling the patient, or are you talking through my chart?
Great question. So depending on the result, a lot of times our patient population is really savvy to my chart. So they like my chart.
Yeah.
So with normal results, I typically will send a message through my chart. Some clinicians might give a phone call.
Yeah.
And then it's fine, follow up with your primary care person or Women's Health Pavilion to get that repeat PAP and HPV test in a year.
Yeah. So what has really struck me about everything that you have said is, gosh, just the importance of baseline and understanding.
Oh my goodness, yeah.
Because think about all the technology. Like, okay, so you have a normal pap smear. Well, then you have a pap smear is really only telling you if there's a instance or perhaps there is irregular cells. There are so many steps that can be taken to before you go from pap smear to cervical cancer. And that's really struck me. Really struck me today. It's just like how many steps can be taken if you are doing prevention.
Oh, it's great. Even if that result, normal is wonderful. The results, if they are precancerous cells, there's something called CIN1, which are precancerous cells that our amazing vagina and cervix can actually clear over a year. So if your result comes back as CIN1, I'm going to say, like, we good. Yeah, so we come back for a PAP and HPV in a year, and both could be completely normal. Like, how cool is that?
That's amazing.
Like, your body just, like, kicks it out.
Your body just sorts it out.
I think some of the national organizations, though, are sharing data that says that there is a lot more cervical cancer, and so get your screenings, and that can be really scary. Like, I'd be like, oh, I've never had one of these.
Yeah.
So what data do you know of that you could share that would say either otherwise, maybe it's awareness and prevention, and that's some of the marketing, but...
Right. So what we're noticing in our own practice is we are having a lot of patients who, when they're due for their pap smear, probably a higher rate of abnormal pap smears. That has to do with the people who are coming back in 5 years are still doing great. It's that we're doing less pap smears, but the pap smears that we're doing, those are coming back abnormal because those are the people that we're more concerned about.
Sure.
So
yeah, okay.
The HPV vaccination has made a huge impact on reducing women's risks of cervical cancer. We know HPV causes cervical cancer, so I can't express. We have like no other vaccine that prevents cancer. Like, that's wild. So please get your Gardasil. It's been approved for FDA approved into your 40s. Like, you haven't gotten it, go get it.
Yeah.
And even if you've tested positive for HPV, to protect against a different strain too.
Sure. Wow.
But people are still getting cervical cancer, and it breaks my heart because it's one of those, if we feel comfortable coming in to get our well exam, if we feel comfortable having our pap smear and our HPV testing, we can catch it. Like, cervical cancers are typically slow moving cancers. it makes us like, whoa.
I know. It's like, it makes me want to call up every single dear girlfriend and say, let me hold your hand while you call to make your pap smear appointment. I will drive you there. I will sit in the lobby with you. I will, whatever you need, I will be there for you, because you just need to know, because there's so much that can be done. It's so easy in our brains to go to immediate worst case scenario. And there's so much that can be done prior to that, right?
Absolutely. Like, as normal is here, cancer is way down there, and we're going to catch stuff at most here.
Yes.
So, like, go in. If you don't feel comfortable with the clinician you're seeing for that initial pap smear or HPV test, cool, say, I'm good. And then I want you to call the Women's Health Pavilion at OMC.
Yeah.
Because I guarantee you'll come in the door. We're going to talk to you, make it make sense.
Yep.
And then you're going to get your pap smear. And it's going to come back normal. And then you don't have to have a pap for 5 years. So get your yearly wellness exams. But if it does come back abnormal, you're going to come in for the colpo. We call it colpo. That's our lingo. And
little slang.
We'll take really good care of you, and it's going to be okay.
I just had mine. I will say, I just had mine at 40, and it was normal. And the feeling too that you have of being like, I do not have to worry about that specific concern in my life for another 4 years now. It's just, it is like a weight lifted off, because there's so many things that we have to worry about these days. Screening for this, screening for that, and this is just one you can check off until 5 years.
Yep, we got you.
Gosh, I feel super empowered from this Pelvis Party episode.
Good.
Thank you. Thank you. As always, thank you so much for joining us for Pelvis Party, and we hope to see you next time.